Hi everybody, welcome back to the Dr. Sia channel. In this video here today, which is the second video in a series of 3 videos, we're going to be talking about why your therapy failed. And in this video, we're going to be talking about therapist competence. So let's get started. This is probably going to be the most unpopular video that I've ever released among therapists out there. And I know it sucks to hear it, but in my experience, the second reason or one of the biggest reasons for why therapy fails is really therapist incompetence. It's simply that the therapist was not able to deal with the level of complexity that the patient brought in, or wasn't able to focus in on a problem. If you saw my other video, for example, we were talking about focusing on an internal problem, and you need sort of confidence and competence to be able to do that. But there are so many other reasons too why therapists fail in the therapy process. I think among therapists, we're mostly keen to be talking about how patients did something or the other to fail the process, to not be able to experience a benefit from the therapy. But really, it is our job as therapists to maximize the potential, maximize the opportunity the patients have for improvement, including helping them see any barriers that they have to therapy. But it takes a lot of skill, and I think this is not a popular thing to talk about because, for example, a lot of therapists are under licenses. They're under, psychology licenses, psychiatry licenses, social work licenses, and licensing suggests that you've reached a certain level of competence. And sure, that is the case. Licensing does suggest that you have a certain level of competence, but that level of competence does not mean that your therapist was competent, that your therapist was able to address your problems and your issues. I think one of the biggest disconcerting things I see sort of growing more and more on websites, and I think this is the number one thing to look out for, is when you look online and you see that a person says that they specialize in CBT, acceptance commitment therapy, mindfulness, psychodynamic therapy, ISTDP, gestalt therapy, schema therapy. And it's like a warning bell should go off for you then that that person is probably not a good therapist. And I'm sorry if you're a therapist watching this and you do this, but you need to be changing that stuff. I mean, I've learned CBT for the first sort of half of my career, and then I've focused the rest of that half on ISTDP, and I still consider myself being basically early career in terms of knowing and learning about ISTDP as a phenomena, as a therapy, as a, everything that is about it. And it's sort of like, well, if it takes me 10 to 15 years to learn to be good at one, maybe 1.5 therapies, no, one therapy, I don't believe that there are people out there, therapists who are competent in, 30 to 40 therapies. It's just not true. That should be your biggest warning bell as before you even book in with anybody. Look up their website, and it says that if this says that they work with just about every disorder that you've ever seen, using just about every therapy, that's a warning sign. It's a warning sign because it means that the person probably doesn't have the competence to know that they're incompetent. And that's a really important thing to know as a therapist. It's really important to know what you know and what you don't know. So you don't work with people you shouldn't be working with, you don't work with problems you shouldn't be working with, and you don't use therapies that you have no competence using. So I think really think about that. And these are, if you're a patient, think about these 2 things. Is my therapist competent? And how can I find out if they are competent going in before I book in? Well, check their website, make sure that they're really honing in on a set amount of problems, and that they're identifying doing at least no more than 1 or 2 therapy styles, because any more than that would be absolute, it's just not true. It just suggests incompetence in the therapist to begin with, or that they're just doing it for the business or for money or whatever. So, and if you're a therapist watching this, you need to really seriously be thinking about that. Like, I come onto your website and I see that you're competent in 10 therapies. Obviously, that's not true. So what's going on, You need to really be thinking about how you're marketing yourself as a therapist. And if you're a patient, You need to really be thinking about this idea that it's not just you that fails that therapy process. It's not just you that does that. You know, it could be a combination of factors. And I know that there are many times where I feel, oh, wow, that patient was way over my head. And so I go and do more training and I go and do, you know, focus in more. But I often let my patients know. I say to them, look, this is a bit over my head. I'm not competent for this. I thought we were going to work on this, but you're bringing this issue in. So I'm going to refer you over to a colleague. I'm going to refer you over to a supervisor. I'm going to refer you over to someone who I know specializes in this issue. And I think that is a very important thing that you can then ask. You can say to your therapist, you know, are you competent in this? Or, you know, should I be looking somewhere else? Or do you have a referral for someone who is more competent? And I know it takes a lot of assertiveness to be able to do that, but it's for your best outcome. And it's also for the best outcome of your therapist, because, you know, people like us can get in a lot of trouble if we don't identify our competencies. And we end up working with a lot of people who we cause harm with. We shouldn't be doing that. So we should have an outlet. And an outlet typically means that we refer on to somebody who's more competent than ourselves. I hope you enjoyed this video. I hope it wasn't too confrontational for you, even though that is what I'm trying to do. Genuinely, honestly, that is actually what I'm trying to do. I'm trying to confront the person on the other side, particularly if you're a therapist, to go, you know, check yourself. But if you're a patient, I'm not trying to confront. I'm just trying to say, sort of, you know, acknowledge this idea that, yeah, your therapist might be making mistakes, lots of mistakes, and they might be incompetent in what they're working with here with you, and that is not okay. You can do something about that. And typically that means get another therapist, get somebody who maybe identifies in one or two therapies, and make sure that you click with them, make sure that they help you find an internal problem, make sure that they help you really see how you can work with this problem that you have in front of you. And if they're not doing that, you know, yeah, time to swap. Anyway, thank you so much. Please subscribe, please like, let me know what you think. Send me your hateful comments. I'll delete them. I won't read them. Send me your positive ones and I'll shower. I'm joking. I'm joking. Just let me know what you think. I really appreciate it. Subscribe, press that bell button. I pop up on your screen. And yeah, that's me. I'll see you next time.